Now starting of surgery, incision is made with 2.8 keratom supranasally with perfect square incision. Inject some lignocaine to anesthetize the eye. Now inject viscoelastic to fill the chamber. Make sure there is no bubble because it make trouble during CCC. And now the cystitome enter into the eye and make sure there is no injure in the incisional area. Now start with CCC, making the flap and raise the flap with continue circumlinear and curvilinear capsular axis. Now gentle with taking the normal curvature of the CCC. During sub-incisional, please be gentle because maximum runout occur at sub-incisional. Now hydrodissection. During hydrodissection, cannula must be placed at the lower lip, so slightly depress the incision, so the extra fluid or extra visco will come out. Now make 1, 2, 3 hydrodissection, so the hydrodelineation and hydrodissection both will appear, and it make job easy for the rotation as well as during phaco emulsification. Now the most important step in the soft cataract, a rotation of the nucleus must be at 6 to 7 times because it will cause loosen of the cortex, loosen of the epinucleus and loosen of the nucleus. So it also polishing the PC, so the remnant of the nuclear material is not there. Now start with phaco emulsification, taking up the epinucleus. Now burying the phaco. Phaco setting is 300 vacuum, 30 flow rate and 60 power. Now this phaco chop, first phaco chop will occur with lateral separation of the nucleus, slight chunk attached to the phaco tip. Now this is the second chop. Now rotate the nucleus. This is the third chop. So slightly cheese wiring occur, so first if you can remove one piece, then remove because to make room for the other pieces to come out. This is a cheese wiring, but the piece taken up with the phaco tip. Now this is a third piece. This piece will come easily and with slight amount of power it may come into the phaco probe. Now this is the last piece. Just take it with little bit of vacuum and it enters into the phaco tip. Now this is a more crucial step during epinucleus. Sometimes surge will occur and we ended up with the PC tear. So with very little vacuum you must take the epinucleus out. These are some chunk of the epinucleus. Yes, this is at the subincisional area. There is 2 epinucleus pieces. Now whole nucleus come out, cortex remain. Now inject visco and start with irrigation aspiration. I preferred mostly Simcoe cannula because with zero pressure it is easy to remove cortex and there is no pressure in the posterior chamber during irrigation aspiration. Whatever you feel good, you can use either coaxial or bimanual or with Simcoe. Now cortex is removed. It is come very easily, so we are safe. If PC or anterior capsule come into the probe, we can flush it out back, so it will goes off. Now the lens is injected into the posterior chamber. One haptic is in the chamber. Now we dial lens into the posterior chamber. It is a Nanex Oya lens preloaded with 1.8 millimeter incision. It easily goes into the eye without stretching the side pot. Now irrigation back of the lens and from the front and from the all the angles. So make sure there is no visco at the end of washing. Slightly tapping over the nucleus is over the lens is good, so the all the visco behind the lens which is trapped is come out. Now the eye looks clear. Slight amount of visco, it never cause rise in the IOP. So now hydro of the incision, always hydro at the upper side, so there is no Desmond detachment. Now lens is perfect position.